Okay, so I wanted to show you why I needled you, where I needled you. So from a skin perspective, I needled you. Go with a non-painful looking color. So I needled you kind of along your spine here. I also got a little bit near your shoulder blade, and then I actually had kind of an arc of them here where you had some rash. So what I want to do is let's clear this off. Let's get the paint off of there. You already know where your paint is. Let's go back and take a deeper look. So if I take your skin off and we're down to just the bones and the nerves. So if I zoom in kind of around the area where you were having pain, and I click on one of these nerves. You can see over here on the side, and if you're on the phone, you might not be able to see this big, but this is actually the part that goes to the skin on the side of your abdominal wall. So what I want to show you is if I look at the origin of that, and we're highlighting it, you can see where it actually stems from your spine. And let me get it in the middle here. So now we're looking at the back, from the back, so it stems from your spine, wraps around, and then the purple branch down here. The little purple part is the actual skin sensory part. So that's where the rash usually kind of breaks out, and you'll see that classic wraparound pattern. And then if we isolate just the origin path without looking at anything else, you can see that that is the nerve in there, and it wraps around to the side of your rib cage. Okay, so let's get back to full body, and I'll show you a little bit where I was. So it's still highlighted, so you see the little blue guy up in here. You see the purple guy out to the side. I had needles right here along the pathway of your spine so that I can get to the root of it and try to desensitize it from there. And then I was actually in your symptomatic area. Cool thing about CBD with trying that is shingles actually damages the nerve itself, like the receptors that actually work well with pain medication. So typically pain medication does not, as you're quickly finding out, it doesn't usually have a ton of effect on nerve pain like that. But it actually does not, in most cases that they're finding, it doesn't damage the cannabinoid receptors, which are what CBD goes after. So I'm hoping, crossing my fingers, that when you have the CBD later, it actually helps to desensitize these nerves better than your pain medication. But I hope that gives you a little bit better overview, and you can actually see why I was kind of up in your spine area and then also out there.